Information line at 505-516-0938 or 888-949-5387. San Juan Regional Medical Center, caring for the Four Corners since 1910.
This
Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning.
Morning.
We can hear us, we can't see us yet, but now we can see everybody.
Cool.
So there you go.
I still can't see us.
I know.
That's fine. I can see you.
That's all you need.
That's all anybody's
Your Monday
asking for.
is complete.
Yes.
You're welcome.
I know. We were just chit-chatting before this about how lovely it's been to get to see another human being this whole pandemic, and that it gets to be you.
That's okay. And you for me.
Yeah.
So there you are.
Chummy. Pandemic buddies.
I agree. So, but it's been great.
It has been.
But we want to let folks know there is a change coming.
Yes.
To the show, and it'll be next week, as a matter of fact. So we're gonna move the show to 2 days a week.
Yes.
From our 4 days a week.
Right.
So it'll be on Mondays.
By listener demand.
And Thursdays.
Just kidding.
Not necessarily.
That was not a listener demand.
That's right. But Mondays and Thursdays, 9 a.m. still same bat station, same bat time, all that stuff, right?
Yeah.
Yeah.
Wow.
That's an old
I know. Well, no,
reference.
I get it.
Okay, good. Well, good.
Holy 2 days a week, Batman.
I know. Shazam. Right. Exactly.
Yeah.
So
yes.
be ready for that, everybody.
Well, yes. So we'll still be on the air, but we'll be on Mondays.
Because I think as things are reopening, I don't know if we need to be on quite so frequently.
Right. I think there's a bit of COVID news fatigue out there.
Yeah.
But there's still plenty to share.
There will be plenty to share.
Right.
That's
plenty
true.
of updates and et cetera.
Et cetera. Exactly. And again, our mission is the same as sharing local information, and that's the whole point of doing this show, because we know everybody can get, if you want to get a lot of COVID in news, you can find it everywhere for sure. There's a lot of sources for that, but there's limited sources for local COVID news, and that's why we're here. So that's what we're doing. So anywho, there's that.
So that will be the change.
Yes, beginning next week.
Yeah.
But this week we're here.
Apologies to anybody who will be bemoaning the change in their morning routine.
I know, but that's all right.
No, it's good.
Mick Hess is still here, roving with the arts on the radio side of things at 9.
That's right, he is.
You can check
roving
that out.
around.
He's roving.
Roving Mick.
He really is.
In a mask.
Exactly. So we kind of keep him in that other studio, so he doesn't mingle.
Stay over there.
That's right. That's right. Exactly. So we have some local numbers and local news to share from the website, which I actually have ready today.
Oh my goodness!
But if you have national, do you want to start with your national numbers?
I love the national numbers.
Okay.
I mean, they're not good, actually. I love sharing them, but I don't like the numbers.
Okay, you're not in love with them.
I'm not in love with the numbers.
You're just
not happy with the numbers.
Understood.
Okay, as of Sunday night, 2,279,875 cases of COVID-19 have been reported in the United States alone, which is an increase of 25,213 cases from yesterday. Again, keeping in the window. We
Okay.
always like to mention that.
Right.
We've seen the 19,000 to 25,000 window, and 119,969 deaths have been attributed to the virus, an increase of 250 from yesterday. This comes from the Johns Hopkins University COVID-19 dashboard. So, reliable source, and still keeping the mortality rate at 5.3%.
Okay. Very good. Well, I mean, not very good,
Right.
but very good that you shared that with us.
Right.
But still, we're watching those numbers, and so there you go. And we know there are some hot spots in the country that folks are
For
concerned
sure.
about.
Texas, Florida, Arizona.
We're looking at you. That's
We're
right.
looking at you.
All those places, exactly.
And
but here,
pulling for you.
that's right. Here in New Mexico, though, we have the numbers from our state, and we can kind of share those from Sunday. And again, another 136 new cases here in New Mexico. And in San Juan County, we had 11 new cases. So again, kind of lower than we have seen. Again, over the last 3 months or 4 months or so, for a total of 2,183 cases in San Juan County. 3 additional deaths in the state yesterday, for a total of 469 now, and one of those was in San Juan County, so that count is now 153, and 56 more recoveries across New Mexico, for a total of 4,684 recoveries,
Nice.
which is good news. And as we scroll on a little bit more, we can kind of see some of the other stories, the breakdown. Again, this is at ksje.com/news. And you can see the detailed statistics there. The Navajo Nation, numbers that came in late last night, they're now with 27 more cases. That number seems lower
That
than
number's
we've
lower for sure.
been seeing. 5 additional deaths on the Navajo Nation for a total of 335. So that's notable. And then the other story I wanted to point out was from Southwest Colorado. And you can see it up there on the screen, is the health department there says that they had new cases of COVID, and there were 6 new cases, and they all came from tourists.
Sorry, Colorado.
Yeah.
Right?
So
They're like,
they're all
"Thanks, guys."
from out of state.
We've been doing such a good job, and then the interlopers entered
Right.
the city.
Well, New Mexico is one of those places where they came from.
Of course it is.
Yeah.
I mean, it's easy access for us, and
Right.
it's a good, 15 degrees cooler up there sometimes, depending on where you go.
Exactly. So anyway, again, just trying to,
Be cognizant of
share
your
the news
neighbors.
and be careful, right,
Love
as you
your neighbors.
travel around. And then the other notable story I wanted to share from the weekend was that the annual Tota Festival, which everyone enjoys in
Yeah.
September, Labor Day weekend, has been canceled
Right.
because of the large gatherings. You just
Yeah.
can't do that.
Nope.
So there's that, which is unfortunate.
It is unfortunate.
And it kind of goes on the list of the other things that have been canceled, which is the Connie Mack World Series and some of these other big
Right.
signature events
For
that we
our
all look forward
community.
to.
Right, exactly.
Yeah. And we talked a little bit about that with the tourist folks from the Convention and Visitors Bureau last week on the 8 o'clock show.
Yes.
So I would encourage folks to check that out to see kind of what their take is on all of this, and just why these things are having to be canceled. We have Freedom Days coming up next week for 4th of July, and many of the events that are normally associated with that are not going to be happening. There are a few. The fireworks show is going to be happening on the...
Do we still have the dachshund race?
No.
See, I know.
That was Riverfest, so that would have been Memorial Day. But thanks for playing.
I'm still learning.
We don't have the dog.
I know. There I am pretending like I'm a dog person, and
We've had a concert at the First Presbyterian Church. That's not happening.
that's not. Yeah,
for Freedom
that's-
Days,
Right. That was a big
because
thing.
of a gathering, and then of course, but the fireworks are happening. I want to
Good.
make sure folks know that in Farmington. Farmington's having theirs on the 3rd.
Okay.
And but the big change there is that San Juan College is normally a great place to view them. The college is going to be closed, so they're not going to
Right.
allow people to come on campus to park and watch the
Right.
fireworks. So there's that. You'll have to find another location. And then the parade on the 4th is going to be happening, and that is going to be here at San Juan College. And that is going to be a little different way. It is a unparade because the floats... Wrap your head around this.
Okay.
You got
I
it?
know. Yeah, I
Right?
had to sit up and really.
Yeah.
Okay, go.
The unparade. So the floats are going to be stationary here in the parking lots at San Juan College, and you, if you want to come see the parade, are going to be driving past them
You're the parade.
on the route of the luminarias. So you'll come in Sunrise Parkway and come into the campus and drive through and see the floats and other entries on kind of displays spread apart in the parking lots, which I think is a brilliant idea.
It is.
Especially because we don't have a main street that we can do a
Right.
parade on anyway, so
Right.
why not do it this way?
Yeah, it is. I mean, hats off to everybody's getting so clever and creative these days.
They really are.
Yeah.
Yeah. So, and we, KSJE, will be providing music for the parades and great patriotic
Correct.
tunes on the radio
You gonna
and
throw some Gershwin in?
on our speakers. We might.
What?
Yeah.
You might.
We might.
Are you an American? Is this
Yes, of course.
Rhapsody in Blue, man? That and Stars and Stripes
Rhapsody
Forever.
in Blue is a
I think so.
4th of July song?
No?
Okay.
I think so. I feel like George Gershwin in general is always
Well, I think
patriotic because he's
that
an American.
He definitely has a
great.
Yes.
Perhaps
track record.
some of my favorite.
Yes.
Come on,
Perhaps.
guess.
Favorite.
Well, I mean, I'm a like
I don't know where we're going.
Copeland.
Oh, Aaron Copeland.
Right.
Yes.
Another great American
composer.
Yeah,
You bet.
You throw
Sure.
in some Appalachian Spring, and I'm there.
There you go.
And what else was I thinking? Oh, Stars and Stripes Forever.
Right.
You can't beat that one.
Well, is there going to...
Let the
Is that gonna be
despots beware.
There you are.
It's a great phrase.
Now, this is the 4th of July, so that is, I believe, Saturday.
I know, we got lucky. It's a Saturday.
And that would mean that there would be a Radio Free Saturday morning program
Correct.
on the 4th of July.
We
so maybe
yeah.
maybe that could be part of the playlist there.
That's true. We are doing a America show.
Good. Okay.
A
That's
United
awesome.
States of America show.
Nice. Well, excellent. I'm just thinking that maybe that could be rebroadcast in the evening during the parade.
That would be awesome.
So
look at you.
Think about that.
I will. I'm in favor. I don't even
More
have to
work
think
for
about
you,
it.
less work for me.
Perfect.
I love
I know
it.
that's how you enjoy.
That is
that's
the
like your
MO.
favorite. Yeah.
That's right.
Yeah.
Exactly.
Oh.
So anyway, everybody. So we're glad to be here with you. We are expecting the CEO of San Juan Regional Medical Center to call in any
Right.
moment.
Right. He's
and
been so faithful.
he has
to
been,
us.
but we haven't talked to him in a few weeks, so it'll
I
be nice to get an
know.
update from Jeff Bourgeois,
Of course.
who will be calling in here shortly.
Chief Executive Bourgeois.
Yes, exactly. So stand by, everyone,
chief.
for that, and then we have another guest coming up at the towards the end of the show, and so we're looking forward to hearing from her.
Right.
Keep it a surprise.
Right, because we want to keep people on the edge of their seats.
Yes.
On our COVID information. Well,
Right.
while we wait, I have an update on antibodies tests.
Oh, we've talked about that, right, with BPL plasma
Right.
and some other guests on the show. So what's
Well,
up with
urgent
that?
care.
That's right.
Right.
The new.
Right. So, according to Bloomberg News, this was a report from last week, and they were really digging into, with health experts, whether or not antibodies are as promising as we thought. And basically, what they came back with was, here's the way false positives and false negatives work. You get a false positive, right? So that would mean that your blood has ostensibly shown antibodies, and then all of a sudden it's a lot easier to become a bit more cavalier. But the reality is that we don't, A, there are false positives exist, but B, even if it wasn't a false positive and you actually did have antibodies in your blood, the reality is we're still not quite sure about immunity, whether or not you have sustained immunity, right? So whether or not it's kind of like varicella or chickenpox was back in the day, you had it once, you were assumed to not going to get it again, that kind of thing. So we're not quite sure about that. So now if you have a false negative, meaning that the blood test came back and it showed that you didn't have antibodies, but maybe you actually did. But on the flip side of that, if you have a false negative, you might remain vigilant, if that makes sense.
Right. Okay.
So the idea is it's kind of like these antibodies tests at this juncture are more for our peace of mind, but that it's like tread with caution because, again, as we've discovered, research about the virus is ongoing, which means discoveries about the nature of the virus is ongoing, but we can confidently say that that it's dangerous, that we need to take caution, that we have some flagging, I think, vigilance going on. We have some, I've been calling it tedium exhaustion. Because life has become more tedious.
Right.
And so it gets a little more tiresome.
Sure.
So, so I thought that was really, really interesting, delving into the science behind all of that. So that is the antibodies update.
Interesting. Okay. But still, I think worth having available.
Yes.
These tests, right?
Right. Well, they said that it's becoming so popular, the demand for it, that even Botox clinics are offering it at this point.
Really?
So next time you go, Scott.
Thank you. Wait a minute.
Wait a
What are you
second.
talking about?
I don't need to go yet.
This is
okay.
all fishing line and putty is what's going on over here.
Ew.
There you go.
Okay.
On that note, let's go
Oh,
to the
look, it
phones.
looks like Mr. Bourgeois is calling.
Let's go to the phones.
Perfect.
Good morning. You're on KSJE this morning. Thanks for calling in.
Hey, Scott. Good morning. This is Jeff Bourgeois. How are you today?
Good morning, Jeff Bourgeois. We are fine, and it's great to hear from you. Thank you so much for calling in to give us an update, of course, from the hospital. And so, give us let's start with maybe your census. How are things looking over there today?
Well, we've been relatively flat, better part of the floor census of 28. So, went up just a touch over the weekend, came back down this morning, and again, been kind of hovering around those levels since around June 15th or so. We've discharged since this all began, Scott. Now 275 COVID patients.
Wow. That's I think that's a good outcome, personally. I'm happy to hear that.
Right. People are recovering.
People
This
are
is great.
recovering.
Mm-hmm.
I have a question. How's the morale doing over there?
You know, Megan, that's a great question. It's I think that's highly variable, depending on who you might speak to. I don't know if you all saw the article that was in yesterday's Farmington Daily Times, where I did acknowledge that, this whole circumstance has been really something that I believe has weighed heavily on the hearts and minds of caregivers. I believe, for the most part, and particularly frontline caregivers, get into healthcare because of a calling to serve their fellow man in times of need. And to see the level of illness and mortality that has occurred not only here but statewide has got to be something that weighs emotionally on people's psyche. And so, we have done a lot to make sure we have emotional and behavioral health support services accessible to our caregiver teams, and the state has done some work in that regard also. So this has certainly taken a toll on all of us in one form or another. It's not anything that the level of suffering that COVID-19 patients have experienced, as well as our own employees, who've lost loved ones or have had people within their families just get sick. All that's a burden, physically and emotionally.
Absolutely. So it's good to hear that some support systems have been set up proactively. Another question I have is about the furloughs. For a time, for a period of time, some employees were furloughed. So do you have an update on that?
We still have employees furloughed, and we are calling them back as our work volumes increase. And we're not sure what the future holds for our the level of patient care volumes we have, and we will call them back on an as-needed basis.
And Mr. Bourgeois, is that because of the some elective surgeries still are not allowed to resume at the hospital, and that's from the state health orders, correct? Or are those easing up a little bit too?
Those are easing up, and we have this week, as a matter of fact, our OR schedule is returning to. Surgeons can schedule within their originally scheduled block time. Block time is a system that hospitals use to allocate OR schedule time by surgeon or by specialty. We do have to monitor the scheduling of elective procedures, both in the OR and in other procedural areas, carefully against the continued COVID-19 census we have, to make sure we are maintaining adequate supply of PPE, and we have done that well. We have adequate supplies, as measured against state requirements, and we continue to gradually open up our schedule.
Very good. And just maybe one final question, Jeff Bourgeois, and that is, as you look at our neighboring states and some of the increases in cases that we are seeing and some of the stresses that their hospital systems are under, is the plan in New Mexico still working, I guess, the way it was designed? I think you were quoted as saying at our peak that things worked fairly well, that the hospital really never seemed to be overwhelmed, even when we were seeing peak cases maybe during the middle of May or so. Is that still something that you're pretty comfortable with, is how things worked?
Yes, just as recently as early this morning, I had a check-in call with the regional hub and folks down in Albuquerque, and the volume there has, in terms of number of calls coming in for patients that need an ICU bed statewide has continued to soften there, and that's good news for us. The system worked about as well as it could have, and certainly the northwest corner of this region of the state, the 3 counties up here, we really tested it at times because most of those transfers from San Juan, McKinley, and Cibola counties were going into Albuquerque hospitals, as well as transfers out of northeastern Arizona coming into our hospital as well as Albuquerque. And it really, the Albuquerque hospitals had to flex up and create additional ICU capacity, much like we did. And, I think it was a well-coordinated system. And again, my thanks and hats off to the folks in Albuquerque at the state who did such a fine job with that. And Scott, I will tell you that, as I mentioned in the article yesterday, this is not over. COVID-19 will be in our country and in our state and in our region for the immediate foreseeable future, and we should not let our guard down. Continue to wear masks, wash your hands, and socially distance. I heard a physician the other day offer a great analogy. If you jump out of an airplane at 10,000 feet and open your parachute, when you get down to 1,000 feet and you've made it 90% of the way there, it's not the time to get rid of your parachute, right?
Good point.
That's a great analogy. You're right.
Yeah, and that's similar to where I think we are now. I mean, we've got the trends going in the right way, but that can certainly turn around on us if we don't just pay attention to what science is telling us to do.
That's
Wash
right.
your hands, wear a mask, and socially distance. As inconvenient as that may be, they are effective and proven practices to reduce the spread of the disease, and that's what we've got to continue to do, not only here but statewide and nationally as well.
That's right. It seems to me that some inconvenience is well worth it in this situation. So we know that this has been a continual learning experience, of course. Obviously, we've heard the word unprecedented more times than I've ever heard in my life. And so there's some talk, of course, about the second wave in the late fall and winter, some concerns about that. So is it safe to assume that San Juan Regional Medical Center is on top of that you guys are planning for the worst, but hoping for the best?
Yeah, that's kind of been one of our mantras throughout all this, Megan, is, we have to plan for potential worst-case scenarios. And the state is doing the same, with as the volumes continue to soften statewide, we are, there's certain parts of the emergency response plan that can be backed off a little bit, but they stay kind of in a standby mode, if you will, and we can reactivate those as needed from a statewide level. And we have plans to gradually shrink our COVID-19 inpatient footprint, i.e. the number of beds allocated to those patients here at the hospital, but understand what we would do if we needed to go back and what our trigger points would be, how many COVID inpatients would we need to have in order to ramp things back up. So our team is working on that daily, and we'll be ready should if and when that happens.
Very good. Well, Jeff Bourgeois, CEO of San Juan Regional Medical Center, we appreciate your time this morning and always during the course of our program, always being available to call in and give us an update on conditions at the hospital and, again, how your staff is faring. And, again, we appreciate it. We appreciate you, and we appreciate the staff at San Juan Regional for keeping us safe and working through this situation with all of us. So thank you very much.
All right. Thank you, Scott. Take care.
All right. You are welcome, sir. That is
Bye-bye.
Jeff Bourgeois, CEO from San Juan Regional Medical Center, joining us on the program today. So good news, but they are still planning ahead, which they have to be doing.
Right, double good news, right? So we are seeing, I like this term softening.
Mm-hmm. Right.
Yeah. Seeing a softening, but also preparing for what the future may hold.
That's true.
So
There you go.
double good news.
Very good. Exactly. And now we're going to go back to the phones?
Yes.
Because we have another
Let's do
guest
it.
who is calling in on the phones this morning. Good morning. This is KSJE. Thanks for calling in.
Good morning, Scott. It's Liesl Dees.
Liesl Dees, friend of the show.
Friend of the show.
We have to say friend of the show. Good to hear from you, Liesl. Thank you for calling in.
My pleasure. How are you all this morning?
We are doing well,
Yeah.
I think. I don't think I've insulted Megan yet.
Let me think. What did you say?
Oh, dear.
Let me see.
Oh, my.
Let's go through.
She keeps
well,
a
I
list.
think I accidentally insulted you. I said something about Botox.
Yeah, there you go.
So,
Yeah. All right.
so there you go.
Anywho,
Cool. As long as one of us pokes fun at the other,
I think that's fair
a
game.
successful show.
I think so. Yes. But anyway, Liesl, thank you for bringing that up.
Anyway,
I'm calling, Scott, to give an update on the Want to Help line that we are offering through San Juan College, City of Farmington, San Juan County, and the United Way.
Excellent. Okay. And so how are things going with the Want to Help line? And this is the, for folks who've been living under a rock for the last 3 months or in their pandemic rock.
you do insult the folks that are ostriching in the sand.
Right. But this is the Want to Help line that's been set up for folks who want to maybe volunteer or find a way to volunteer safely during this whole time.
Exactly. And you can find our information by going to the City of Farmington's website, which is fmtn.org. And if you look for the COVID information, click on that, and then you'll see the Want to Help line is one of the COVID-related pieces of information available on that website. And what we've got there is a spreadsheet of ways that you can help, and we have not updated it in a while because we aren't aware of any significant changes. But sometimes there's a little something to mention or emphasis. Jeff was talking about the article in the paper yesterday about staff morale and how staff is doing. The Daily Times also had an article on Friday about San Juan Regional, and this article was about their looking for more surgical caps and masks. And there has been, of course, a small army of mask makers in the community, and just wanting to reach out. Again, people are very active on social media, but for any listeners who aren't on social media and aren't part of the Facebook Making Mask group, and they're interested in connecting more around making masks, we want to encourage them to do so, and we're happy to help facilitate that and give them information if needed.
Very good. So, related but somewhat unrelated, what's the coolest mask you guys have seen?
Oh,
Yeah.
Liesl. Are you asking me too?
Oh, Megan.
I'm asking. Sorry. Oh,
It's on the spot. See
dang
how,
it! I know.
See
Well,
how she is.
I have answers.
Can I give you my answer to that?
Of course.
My answer for the coolest mask is any one that someone happens to be wearing.
Yes.
I recently did a lot of driving and can report that New Mexico is rocking it when it comes to masks in comparison to every other state. Oh, but my sources tell me from here to Florida.
Oh, my.
But
Okay.
Oh my!
Yeah.
Always one for
Florida.
anecdotal research
Wow.
there, Lisa. But you're right. That's actually a perfect answer. I was going to go much more shallow. So, thank you for that.
I was going to say that. Well, what is your mask?
Well, I have
Get that
one.
first.
En route, it's Edmund Munch's The Scream. So that's
Oh,
a new mask. Yeah.
Okay.
Yeah. This seems appropriate to the current malaise of the times, but you're right. Any mask is
Right.
the way to go.
And anyone who's seen your Facebook page knows you're sporting the KSJE,
The KSJE
mask,
mask.
purple and gold.
That's right.
So there
Look
are
at
those,
us.
but that's okay. People have been very creative with everything. Masks masks included. So there you
Well, to be on brand and to go with the picture that you all have of me, I ordered a set of masks from the Hustle Kindness store, and it says kindness is essential. Hustle
Oh, nice.
Kindness.
That
On
is
my mask.
nice and true and very on brand.
There you go. And we just had
Yeah.
Madison Peach Steiner on the show last week, I believe it was.
It was last Thursday.
yeah.
I heard.
So there
Yeah.
you go. So perfect.
And I thought, to also be on brand to spare you from the question that you're going to ask me at the very end, which is if I have a song for you.
Yes.
Okay.
Every now and then when I start talking about masks, my brain jumps into mask maker, make me a mask.
Oh, okay. Wait, so that's a Fiddler on the Roof reference,
Yes.
right?
That is.
Cool.
Okay, so
Yeah.
now you can have an earworm. You're welcome.
We do.
That is awesome. We applaud your courage and your consistent on-brand nature.
And your musical repertoire.
Right. Total.
Yes.
We got it all. We got the research, we got the helping, the kindness, and the song. So
Perfect.
All right.
You've checked all the boxes, Liesl Dees. Thank you.
Well, to go back to checking the boxes of why we're really here, to go back to what we have in terms of volunteer encouragement on the Want to Help line, we know that people's interests have changed and kind of what people are able to do has changed. So please go online, check out our list of opportunities of things that we know about. If you are an agency and your needs have changed and you've got some volunteering opportunities that you want to make the community aware of, please call our helpline for that as well. And let me give the number. It is 566-4210. That's 566-4210. We'd love to hear from people, and we'd love to hear from people who want to be contacted again. We have had a variety of simple needs that have come up throughout the past couple of months where we've gone back to people who have called us, and people have helped us out. It wasn't what they initially called us about for, but once we know that you're someone who has time and an interest and willingness to help, we've gone back to people. So we really appreciate knowing that.
Good to know. And we're
know.
showing the kind of the website screen grab on the screen right now for folks to see what they would be looking for on the City of Farmington's website for that Want to Help location, and to click here for the list, that Excel spreadsheet of what's going on right now.
that's right.
So there you go. And go ahead, Liesl.
And let me go back to San Juan Regional and the article that I referenced in the Daily Times. They are looking for people to make masks and surgical caps, we specifically are looking for some experienced seamstresses. We are aware of some kits that have been sent from other communities. So particularly if you're not on the Facebook group or you have a seamstress in your family who is not on the Facebook group and you'd like some materials to work with, we would be happy to connect you with the people who are involved with that. So if you've got some seamstress skills and want to help out San Juan Regional, please give us a call at 566-4210.
That might be a nice, to counteract any bad habits that we've picked up during quarantine, to try a new helpful skill.
Right, making
Become a-
masks.
right.
Sure. That makes sense.
Like there
to
was
me.
that bread making craze in the beginning.
Oh yeah, right.
You
I
said
missed
that
one.
with disdain.
Well, I missed it. I missed
Oh,
it.
yeah.
Because now everyone's gained 15 pounds and see where we
Right.
are.
Everybody's got their sourdough starters.
And now, Scott, you can pick up some good exercise habits.
Okay.
Just Same.
Yeah, you could.
You've met me, right, Liesl?
Scott's favorite gym is the patio.
That's right. Exactly. But that does make sense. And I think,
Yeah.
a lot of folks are finding new ways to occupy their time. We talked to the HHBC this morning at 8 o'clock about the people getting back out to exercise. So I agree with you, Liesl, that people are doing that.
Kindness and exercise.
Exactly.
Name of the game.
So there you go. Perfect. Well, Liesl, thank you for calling in and sharing all this helpful information as always. And even though as we see things kind of reopening and people may be getting back into their maybe other habits pre-COVID, that there is still needs out there, and that's why the Want to Help line is still active and working, correct?
Absolutely. And we'd love to know about other needs that are in the community. There may be organizations who are taking volunteers now that weren't a month ago. And if you are looking for people to help you, please let us know.
Good to know. All right, very good.
Great.
Thank you, Liesl.
Thank you all. Always a pleasure.
Do you want to do another stanza of Mask Maker before you go?
Yeah.
Only if you sing along, Scott.
Ooh.
I will sing along, but I'll turn the mics off.
You want me to add a harmony?
Yeah, Megan can really sing. Maybe that. Yeah.
Megan is
And-
the
and
singer
Megan
of the
has
two
an
of us.
earworm.
That's
Yeah.
for sure. Yeah.
Mask maker, mask maker.
I don't think that's the lyrics. I don't think so. But thank you, Liesl.
Thank you, Liesl. Friend of the show for a good reason.
That's right. Thanks, Liesl Dees. Take care. Liesl Dees from the Community Learning Center here at San Juan College. You weren't going to sing?
I know.
You haven't warmed up?
Yeah.
It's too early.
Right.
for
I
your
mean,
voice.
there you go. Like, lesson learned. Don't mention harmonies unless you're ready
You ready to bring
sing
it?
them.
That's right. Yeah.
So,
There you are. But anyways, no. But great person, great guest,
of course.
great effort. The
We
Want to
love
Help
Liesl.
line.
That's
So
right.
there you go, everybody.
That's
So
right.
definitely check it out and see if there's something maybe that you could help with. And these masks, these other things that folks could make at home are I know very important to the hospital and other groups around around town.
That's correct. That's correct. Particularly congregational settings.
Right.
And I don't mean like church congregations. I mean, although, we should wear masks there too.
Right.
I
You
mean,
should.
like assistant living and the jail, I know, could use
Right.
them.
Right.
And it's just another example of the whole marathon nature of this disaster in the sense that there was a lot of talk and a lot of energy behind mask making in the beginning. We haven't heard about it for quite some time, but of course the need is still out there because this is, I've never wanted to hear a more specific answer to for some time or for quite a while. Like, it seems like it's going to be going on for quite a while, and you're like, can you please define?
Yeah.
Put some parameters around
But they
that?
can't.
No, they can't. That's
true.
We just don't have that. So
And I think, again, at the beginning of all this, the supplies of masks were very short supply. We remember hearing those reports,
Right,
too.
buying masks,
Buying
right,
masks
right.
and the specific type of mask, right? Those N95 masks that folks really needed at the hospital setting. And so a lot of folks are still saying, well, why are these cloth masks needed when hospitals need these specific types of masks? So they're not necessarily for the healthcare workers, but for the patients.
People coming in.
The people coming in.
That's
Maybe the admissions people
That's
that
right.
maybe aren't medical
Right.
people.
Front desk people.
Yeah,
That's right.
So that's kind of what we're talking about, and that's why the need is so great.
Right. And anything is better than nothing. So.
Right. But if you have a family coming in and you're trying to get them to visit, maybe it's a non-COVID situation, but you still want them to wear masks and they don't have a mask, you
Right.
give them a mask.
Right.
And there you go. And then now that's their mask. So you need more to replace that.
Right. Yeah, we're not going to rotate the masks.
No. No, we're not. So there you go.
So yeah.
Yeah. Perfect.
Cool.
All right.
Great show.
Good show. I agree. And I think that will wrap up today's show, but we'll be back tomorrow, everybody. 9 a.m. right here on Facebook and YouTube. And again, at noon, you can hear this on KNMI Radio, 88.9. And again, at 5:06 p.m. tonight on KSJE, 90.9 FM and 103.3 FM. But we will see you tomorrow. Have a good Monday, everybody.